siphinde sikwamkele enkqubeni sabukele iKids News. Njengoko inani labantu abasuleleke ile ntsholongwane ye-COVID-19 lisonyuka kwihlabathi ngokubanzi kunalapha eMzantsi, nombutho wezempilo World Health Organization uchaza njengobhubhane wesifo esiqhambuka embombo zehlabathi. Umbuzo ezingqondweni zethu samile, sizikhusela njani? Ukuthela banzi nathi ngaloma seniphathele ugqirha Rakomakoe ovela kwi-Quad Care Medical Center. Doctor, welcome to Kids News. Thank you for joining us.
Thank you so much for having me, Togo.
Okay, let's get straight to it. What is coronavirus?
Okay, so coronavirus, it's a group of viruses,
Yes.
that cause respiratory illnesses. So respiratory means from the nose and throat all the way to your lungs, depending on how severe it is.
Okay, so do we have official treatment for this virus?
No, there is no official treatment for the virus.
So what are the symptoms of someone infected with COVID-19?
All right, so the symptoms will look a lot like your flu symptoms, normal flu symptoms. A dry cough, shortness of breath, you can have chest pain, fever. If it's very severe, some people can get pneumonia where they are actually hospitalized.
Okay, so, we are approaching a cold season. When that
Yes.
happens, people usually fall sick. They have fever, flu, they start coughing, sneezing, having running nose.
Yes.
How do we differentiate normal flu symptoms and fever symptoms and the actual coronavirus symptoms?
Okay.
And can an infected person spread the virus if they don't have the symptoms?
Okay, so in terms of differentiating, that's a good question. There is no way of saying this is flu, this is corona. So it will always be based on suspicion, especially if someone has traveled or they have been in contact with someone who has traveled or they work, in a health setting. So the symptoms are the same, but what's nice about that is it makes us aware that we, like with the flu season, we all need to protect ourselves from flu, being the number one cause of illness in this season, yes.
And we should keep the same measures on coughing and sneezing and everything.
Exactly, the same measures.
So most confirmed or reported cases of COVID-19 are of adults.
Yes.
Now the question is, are adults more susceptible to the virus or more likely to get it compared with the children?
With the children.
Yeah.
So the younger the child is, the more at risk they are with getting ill once they contract the virus. If adults are physically fit and they don't have chronic illnesses like your HIV, diabetes, they are not that much at risk of contracting it. Even your older people older than 60 years old, they are also at high risk of getting infections.
Okay, so those that have compromised immune systems are at higher risk of contracting.
Yes, they are at higher risk of contracting it and actually getting ill from it. Because people need to know that just because you contract it, it does not necessarily mean that you will be ill.
So does the clinical presentation of COVID-19 differ in children compared with adults?
No, the symptoms, like I said, are the same as the flu symptoms. So you'll have your coughing, fever, general body pain, and also being feeling sick. Yeah. Generally feeling sick.
So at what point do you decide that, this is not flu, this is not fever? Maybe I should go and see a medical doctor and get tested.
I think when you have a positive travel history, the minute you get flu, you must have a suspicion, that you might be having the coronavirus. And when you go to your doctor, do tell them about your recent travels.
Recent travels, okay. So there's a big debate about the face mask.
Yes.
Now, who should wear the face mask, and is it necessary to keep us safe from contracting the
So
disease?
the face mask is for people who are ill or suspected of being ill. It's not for everyone to just walk around wearing masks, because it does not protect you, from getting the infection. But it protects the person who's infected from spreading the infection.
Doctor, my biggest phobia is snakes and all of that.
Yes.
But that's not the case anymore. Now, my phobia is touching. I don't want anyone touching me and all of that. I don't want to shake hands and all of that. So how do we get rid of this paranoia? How do we keep calm and try to remain calm during this
I think
panic?
what this epidemic or pandemic has done is really remind us of hygiene and good hygiene. How do we cough? You need to make sure that when you cough, you cover up. There's how they teach children these days, they say there's a cough pocket, rather cough like this than coughing into your hands, because once you cough into your hands, you touch other things. We talk about washing your hands regularly with soap. If you have access to a hand sanitizer,
you can
use it all the time before you touch things. If you can disinfect the air, then do that. So it's just about us going back to the basics when it comes to hygiene.
So in closing, what advice would you give to the children and parents watching at home?
Yes, we are going into the flu season, like you say. The season in this country is where we have high rate of flu, you know, and people getting sick. So the basic hygiene that we talked about is very important. Make sure you cough away from your hands, you know, but covering up. Make sure you wash your hands and sanitize them if you can, and vaccinate for flu, because you are more likely to get infected with flu than getting infected with the corona.
Doctor, thank you so much for taking time out to come and have this conversation with us.
Thank you so much,
It's been
sir.
very insightful. We hope that our viewers have learned a thing or two from this.
Thank you so much.